This is the second lecture in the antibiotic series of bug versus drug, where we talk about the two other classes of Betalactams, Monobactams and Carbapenems. So back onto the spreadsheet, we need also to consider the drug flucloxacillin in the penicillin group. Flucloxacillin is a drug which is primarily used for Staph aureus infections and is also got quite good activity against Streptococcus pyogenes and other kinds of beta hemolytic streptococci. It is quite a narrow spectrum drug and doesn't have activity against anything else. But because of its quite specific action just against Staph aureus and Streptococcus pyogenes, it's used in lots of skin and soft tissue infections such as cellulitis. The third type of beta-lactam antibiotics are the monobactams, and there's one agent commonly used that's in this group, and it's aztreonam. Aztreonam has a particular place in people with type 1 hypersensitivity to beta-lactams. It doesn't have the side chains that cause most of the allergies, and so it can be given with impunity. It doesn't have any gram-positive action at all, and so if it's used in a mixed infection, it needs to be used with agents that have gram-positive activity. And because the patient's got major penicillin allergy, they're usually on vancomycin to give that gram-positive activity. Now, with respect to the gram-negatives, it's quite good against E. coli, and there's issues with the escapum and ESBL organisms, but interestingly it has anti-pseudomonal activity, no anti-anaerobic activity. The fourth group of beta-lactam antibiotics are the carbapenems. Meropenem is the usual carbapenem that's used. It's the broadest spectrum antibiotic that we use, and accordingly, whilst it's got excellent activity, it's also prone to select out multi-drug resistant organisms such as MRSA, VRE, some very resistant gram-negative organisms which are called carbapenem resistant Enterobacteriaceae, or carbapenemase producing Enterobacteriaceae. The use of meropenem should be reserved for people that have infections with very resistant organisms. There's another carbapenem that's available called ertapenem. Ertapenem has a long half-life, and so can be given as a once-a-day injection, and this allows it to be used in ambulatory care. It's particularly useful for treating patients with ESBL, urinary tract infections, where there are no oral agents that are available. You need to know that ertapenem does not cover Pseudomonas aeruginosa, unlike meropenem. That brings us to the end of the beta-lactam part of the lecture series. The third lecture is about non-beta-lactam antibiotics.